This video will provide a brief overview of what pulse oximeters do and how they work. It will also provide an introduction into what different readings mean for you as a patient, as well as what setting options exist. A pulse oximeter is a device that is used to measure the amount of oxygen in your blood. The device shines a light through your finger and measures how much light gets absorbed by red blood cells as they pass through it. This information is then translated into a reading which tells you the amount of oxygen in your blood. Pulse oximeters can be used to monitor patients who are recovering from hospitalization and surgery, and those who need help breathing at home. They can also be used to monitor babies and young children who have heart or lung problems, or those who need help breathing for any reason. Pulse oximeters are used to measure the oxygen saturation of hemoglobin in arterial blood, which provides useful information about the patient's level of oxygenation. Pulse oximeters work by shining light through a part of the body and measuring how much is absorbed by the hemoglobin in different blood cells. The amount of absorption is proportional to the amount of oxygen in those red blood cells and can be used to estimate how well oxygenated your lungs are. It works by measuring the amount of oxygen in a patient's blood and the amount of carbon dioxide in their lungs. A normal level of oxygen is usually 95% or higher. Some people with chronic lung disease or sleep apnea can have normal levels around 90%. It's a rather inexpensive tool that is actually quite small. It's important to talk to your doctor or other professional before beginning any sort of supplementation or treatments. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.